Hi, my name is Dr. Linda Lowenstine. I'm Professor of Veterinary Pathology at the University of California at Davis School of Veterinary Medicine. The topic for my talk is going to be the pathology of zoo and aviary birds. Since I'm assuming many of you are studying for path boards, this is going to be a visual experience. There will be a lot of slides presented very fast with various morphologic manifestations of some of these diseases. So bear with me and let's start with the first slide, please. Okay, so the first won't work. The challenge of zoo and aviary, particularly zoo avian pathology, but also aviaries, is that on any one day or at any one time, the pathologist may be presented with birds ranging from 150 kilogram ostrich to a 10 kilogram hummingbird, with everything in between, such as this fairy bluebird, which represents the order of passerines, or this shoe-billed stork, probably one of the homeliest birds in a zoo, but also one of the most valuable. A large zoological collection, like the Zoological Society of San Diego, may have birds representing as many as 23 to 24 of the 27 recognized orders of birds, and up to 500 to 700 of the recognized 8,700 species. It's quite a formidable task to learn about the biology of these birds, which may be very important in interpreting the pathology. Fortunately for zoo pathologists, some correlations can be made with domestic birds. For example, this Argus pheasant is closely related to domestic poultry like chickens and turkeys, and literature on those species can be used to interpret diseases of that species. This crested screamer doesn't look much like a goose or a duck, but actually it is, and diseases that affect anseriforms in general may also infect these zoo birds. The domestic pigeon and the literature on the domestic pigeon can serve to model exotic colubiforms like this crowned pigeon. And fortunately, there's also an expanding literature on birds of prey, such as this Harris hawk, and on pet birds, particularly the citizens and the small passerines, like these owl finches. So the zoo pathologist has many resources that have increased over the last few years to help with diseases of zoo and aviary birds. But there are always some surprises. This is a crassid. They're related to chickens. He's a curassow. And although they're related to chickens, they may manifest some very bizarre anatomic variations. And in the razor-billed curassow, you can see this trachea bending back and going actually through the sternal plate. So how do you recognize normal from abnormal? And sometimes that's one of the biggest challenges. This is a normal accrescence of the breeding regalia of a white pelican. But these accrescences around the face are pocks. So normal from abnormal can be a real challenge. A book that's a help in zoo birds are some of the avicultural texts, or rather the ornithological texts, such as this book by King and McClellan, which goes through the structure and function of birds and often mentions many of the stranger species that we find in zoos. Helpful one for mammals, just as an aside, is this comparative physiology of the vertebrate digestive system. Another challenge that's present in zoo and agricultural avian pathology as opposed to pet bird or even poultry is the fact that many of these animals live in naturalistic settings with free access to substrate. Here this hoopoe is foraging for pill bugs in the exhibit, not part of the planned diet, and creatures that can act as intermediate hosts for a variety of parasitic diseases. Foraging on non-regulatory food items can present quite a few problems. This red-headed duck has decided to eat an apple snail. This poor female was also egg-bound, so between the apple snail in her glottis and the egg in her cloaca, she ruptured her right ventricle, straining to survive. These naturalistic habitats make for a much nicer environment for zoo and aviary birds. They can forage for appropriate nesting materials on the ground, but they can also get into trouble, as this impacted gizzard from an ostrich shows this animal had been foraging off of various fiber things, including astroturf, which was highly undigestible. The large naturalistic enclosures often have multiple birds and multiple species of birds exhibited in the same area. This can lead to several problems, including competition for feeding stations. And if a dominant male decides the feeding station is in the center of his territory, it can lead to cases of starvation or conspecific and interspecific trauma, which are fairly common in zoo and avicultural practice. Another problem with mixed species exhibits may have to do with dietary requirements of some species. Some of the birds, such as the birds of paradise, the mynas, and starlings, develop hemochromatosis or hemosiderosis or iron storage disease. Starlings and birds of paradise and mynas are the best known, but also some of the American tanagers, things like this euphonia, some of the carassiforms like the Indian roller and the fruit doves, seen in this picture, are also susceptible to iron overload diseases. If they're kept in multi-species exhibits where high iron foods are being offered to some species, they may select those instead of the low iron foods that are more appropriate. This is a case of severe iron overload. In the initial stages, excessive iron storage is called hemosiderosis, but when hemosiderosis or the iron accumulation leads to damage to the organ or tissue, either morphological or biochemical damage, the disease is called hemochromatosis. And this is a case of hemochromatosis in a myna bird. You can see the dark, almost rusty brown discoloration of the heart, the liver, and the GI tract. These birds often present with liver failure, with acidic fluid in the coelomic cavity, represented here by these fibrin tags over the surface of the liver. On H&E, the liver almost appears orange. The amount of iron is so intense in the hepatocytes. And with Prussian blue stains, you can see that the iron stain is mostly present in hepatocytes with some larger aggregates in Kupffer cells as hepatocytes become necrotic. In these iron stores, such as the mynas and the birds of paradise, iron may also be present in multiple other organs and tissues. This is a Prussian blue stain section of the kidney showing marked iron accumulation. It will also be present in the heart, where it can lead to cardiac arrhythmias, and in endocrine organs, where it might lead to endocrine dysfunction. Iron storage is seen in a variety of settings in zoo birds, and in some of the hornbills, like this silver-cheeked hornbill, we see a more nodular form of hemosiderosis and hemochromatosis. The reasons for this are not entirely clear. It may represent an underlying infection which predisposes them to accumulation of iron. But here you can see this nodular form of siderosis. And in contrast to the more diffuse form of siderosis that we tend to see in the starlings and birds of paradise, in which the spleen is not involved, in these hornbills there will be marked splenic involvement as well. And this again suggests the possibility of such problems as aplastic anemias, which we don't always find, chronic inflammatory disease, which we do usually find in the hornbills, or some other mechanism that we don't yet entirely understand. Some other zoo birds in which iron storage has been seen include the flamingos, and in flamingos we can usually demonstrate that the animals are chronic pourdours with chronic underlying disease problems, making the iron storage a secondary problem. While I'm thinking about it, this reminds me to say that in utilization of exhibit space you have to be careful of the kinds of food, and if you're even among flamingos there may be differences in foraging ability and habitat utilization in the wild, and so pellets, flamingo pellets that are appropriate for one species of flamingo may not be appropriate for another and may lead to starvation, and we found this with greater and lesser flamingos. The greaters can tolerate a larger pellet size because of their feeding apparatus than the lessers can. The body of literature on iron storage disease in zoo birds and wild birds is expanding. From studies done in Europe, we recognize that there's a seasonal variation in the amount of iron in the livers, that during brooding and molting, when birds are fasting, iron tends to accumulate more than it does at other times of the year, and that's particularly been shown in eiders and some of the other diving ducks, and we even see that in mallards. the seasonal variation in iron content that can be mistaken for a pathologic change. Iron will also accumulate in the face of toxicoses, and this is a little cockatiel with lead poisoning. In the cetacines, lead poisoning often leads to hematuria, which is not a feature in some other species like Anseriformes. And one of the earliest changes in experimental lead poisoning is accumulation of iron both in hepatocytes and Kupffer cells. And again, a Prussian blue stain demonstrates this. So just because a bird has iron storage disease does not mean it has a primary iron storage problem. To continue with the lead poisoning theme, here's kidney. These birds often have some renal tubular necrosis, and the inclusion bodies of lead poisoning are quite difficult to see in birds in contrast to mammals, and when you do the acid-fast stain, you can see they're just these very tiny red granules adjacent to the nucleolus. Another feature of exhibit design in many zoos is the presence of nice water elements. This is great for birds like this waldrop or ibis that require water, but the public likes to throw coins into the water. It's a very popular thing to do, make a wish, and if birds eat the pennies, they have a high zinc content, and once the copper coating is worn off, they get zinc toxicosis, which is usually represented by severe pancreatic degeneration, fatty change, and disruption of the pancreatic islets. These nice naturalistic exhibits attract a variety of wild animals, including migratory waterfowl. During the warm periods of the month, some of these especially shallow waterfowl ponds, can cause great outbreaks of botulism. Botulism outbreaks have plagued many zoo collections. Birds first lose the ability to fly, then the ability to walk, and it isn't until late in the course of disease that classic limber neck is seen. Of course, there are no pathognomonic histologic lesions in botulism. It's a biochemical toxicologic disease. Newer ways of feeding birds so that the food is kept here and yet there's still water for the animals to dabble in, but out of the main exhibit, has cut down on the incidence of botulism in many collections. These are red-fronted geese from Siberia. Another thing that can be brought into collections by wild waterfowl is duck viral enteritis. This is a herpes virus. The classic lesion of duck viral enteritis is annular band necrosis. These areas overlie the lymphoid annular bands of the Anseriform GI tract. This lesion is pathognomonic when you see it, but you don't always see it. These slides were compliments of Dr. Brad Barr from the California Diagnostic Lab. And in this particular duck, you can see the ulcerative lesions in the esophagus and in the cloaca. And a good place to look for these are at junctions, like between the esophagus and proventriculus, proventriculus and ventriculus and duodenum are also areas where you tend to see lesions, and this is probably because of aggregates of lymphoid tissue normally present in those areas. Histologically, it's an ulcerative lesion with some proliferation of the superficial epithelium. Inclusion bodies are both intranuclear and intracytoplasmic in this herpes viral disease. Other creatures besides exhibit animals, find zoos and aviaries attractive. This little mouse is nibbling on an avocado that was put out in a New World tanager exhibit. And these English sparrows are finding this food tray just perfect eating for them instead of for the birds it was intended for. These animals can bring a variety of infections into the exhibit. Also, the public really doesn't seem to distinguish between being at the zoo to see exhibit animals and to see native wildlife that might fly around. So the kids are just as happy to throw popcorn to gulls as they are to, fortunately they're not throwing the popcorn to the zoo animals, but so that increases the attractiveness of zoo grounds for a variety of wild creatures. And these in turn can transmit diseases to collection animals. This is a thick-billed parrot. It's an endangered parrot from the southwest US and northern Mexico. And you can see these ecchymotic hemorrhages in this bird and the evidence of hemorrhagic diarrhea around the vent. And this bird had Salmonella enteritis, presumably brought in through rodent encroachment on exhibits. An example of acute septicemic salmonella, and salmonella in zoo and aviary birds can have a variety of manifestations grossly. Usually it's Enteritis or Typhimurium, although we do see other types of Salmonella, including Arizona and some others. In the subacute forms of the disease, you can have abscesses in multiple organs and tissues, here in the breast muscle of a blackbird. And here's a series of blackbirds from an outbreak that took place in wild birds and then spilled over into a zoological collection. And you can see that it's characterized by hepatomegaly, quite marked in the bird on the right, as well as massive splenomegaly. And remember that the passerine spleen is usually an elongated comma, and here you can see this very dark spleen, here a spleen with multiple foci of necrosis, and here another big dark swollen spleen, as well as evidence of enteritis. Occasionally we see oddball forms of salmonellosis. This huge mass on the breast of a white-headed pigeon was a caseous granuloma, and almost a sarcomatous lesion that I thought was going to be tuberculosis, and we grew a pure culture of Salmonella arizona out of this particular bird. Another bacterial disease that can be transmitted by feral rodents and birds is yersiniosis. Both Yersinia pseudo-TB and Enterocolitica have been isolated from birds in zoological collections, but most often it's pseudotuberculosis. The disease can have two different manifestations, a more granulomatous or multifocal manifestation and a more diffuse histiocytic manifestation, very similar to the lesions that we see in true mycobacteriosis. And here you can see a greatly enlarged spleen from a red-capped lory with multifocal necrosis in it, and a diffusely enlarged spleen from yersiniosis in a red-capped lory. You can appreciate the modeling here. Gives you an indication that there is a hepatitis present. And from a turaco, again, a diffusely enlarged spleen with some little granulomas in it. And of course, histopathologically, yersiniosis in birds resembles that in mammals with these large multilobate colonies and varying amounts of inflammatory response and necrosis around them. Feral birds have also been implicated in the introduction and spread of tuberculosis within aviaries and zoos. The transmission is not direct, but fecal shedding by the feral birds can contaminate the soil. And as you know, these organisms can last for a long period of time in the environment. Tuberculosis and Zubirds, as Dr. Matali has mentioned in his tapes, can either appear as a granulomatous form, as we see in this liver from a goose, again in a falcon, or in a more diffuse histiocytic form, as we see in this BB parrot. Some species of birds seem to be quite susceptible. Among the citizens, the Brotarigus species seem to be the most sensitive. And another Brotarigus with an enlarged pale spleen and the diffusely enlarged liver. Also, you can appreciate the opacification of the GI tract due to thickening of the wall. Here in a red-billed pigeon, greatly thickened duodenal loops. Fixed specimens showing this shaggy appearance to the intestinal mucosa, and then widespread dissemination to bone, to muscle, skin, everywhere in the body. Unlike mammalian tuberculosis, pulmonary involvement is rare. This is in a red-billed pigeon. And the histologic lesion, the classic granulomas are like you'd expect in other species, but this diffuse histiocytic form can sometimes be misdiagnosed to the uninitiated as almost a histiocytic sarcoma until you do an acid-fast stain, like on the spleen, and can see these zillions of organisms that characterize avian tuberculosis infection. And here this organism-laden histiocytes are thickening the intestinal villi, and that's what gives it that Turkish towel appearance to the mucosa. Cetacine birds are susceptible to human tuberculosis, and with the increased incidence of human TB in urban populations in this country, it's always a concern. I used to feel very confident that if I saw few organisms, I was dealing probably with either a bovine or MTB, a mammalian form, and if I saw lots, I could breathe a sigh of relief and say it was definitely avian. But recently I had a case, actually in a pet bird, not a zoo bird, with multitudinous organisms from which M. tuberculosis was cultured. So I don't feel as confident as I used to. Birds like feral pigeons can also introduce protozoal diseases into collections. This is a case of trichomoniasis with these turban lesions in the esophagus of a pigeon, and then a more diffuse plaque-like lesion in an owl, in which the organisms have invaded the palatine salivary gland. On histologic section, the organisms are sometimes difficult to recognize in the lesions, and in the deeper tissues often just give sort of a soap bubble appearance. PAS stains can be helpful in elucidating these organisms. Other protozoal diseases that can enter collections, presumably from wild birds, include coccidial infections. And there's some question about the specificity, particularly among passerine species, of coccidial infections. Some people believe that they're quite host-specific, and others think that there's enough circumstantial or epizootiologic or epiornitic evidence to suggest that they are transmissible species to species. This is a case of intestinal coccidiosis in a tanager, and one thing that we see in some of these small zoo passerines is a marked lymphoproliferative response in the presence of these coccidia. Here you can see the various gametocytes in this particular tanager. The lymphoproliferative response is so florid that a diagnosis of lymphoma comes to mind. Many of these birds have also had concurrent atoxoplasmosis. Atoxoplasma is an apicomplexan parasite related to some of the other avian coccidia. It generally infects not only the GI tract in one stage, but it also has a leukocyte stage in which zooites infect circulating, mostly mononuclear cells, also perhaps lymphocytes. These animals will have massive hepatomegaly and splenomegaly. This is a Fukian niltava, little passerine. And histologically, the lesion is one of a marked, again, almost lymphomatous proliferation of mononuclear cells surrounding vessels in spleen, lung, and other tissues. And the organisms can be found either singly or multiply in mononuclear cells, and usually the cells are characterized by a flattening or almost a crescentic indentation of one side of the nucleus. This is a serious problem in some groups of birds, particularly in the collection at the Zoological Society of San Diego. It's very difficult to treat. It's also a problem in Ballymynas, an endangered species scheduled for reintroduction. Besides feral birds, a variety of other wildlife find zoo grounds attractive. These little opossums may seem cute to some people, but the coccidian carried by opossums, Sarcocystis falcatula, can also infect birds as the intermediate host. And when it does so, it may be a fairly inapparent infection in some species, but in the fruit doves, many of the psittacines, and some of the passerines, it causes a very severe fatal sarcocystosis when the organisms are in the endothelium. And this is a case of fatal sarcocystosis in a Desmond's fig parrot, a very rare parrot. Here's a marked splenomegaly, multifocal necrosis, and petechiation on the heart. I think you can appreciate the degree of pulmonary edema, which is usually, I think, the lethal lesion. Here in another bird, the lungs are very discolored and brown and wet. Kidneys also somewhat swollen, and marked splenomegaly. Some birds survive past that stage to have encystment in the muscles, and here you can see a very severely affected yellow-throated laughing thrush. The animal went on to die, even though the muscular stage had been reached. And what we see are these schizonts and endothelial cells in the lung. They often form large serpiginous arrays following the contour of the lung capillaries, and this leads to endothelial damage. We'll also see non-suppurative encephalitis associated with this disseminated sarcocystosis. In other birds, sarcocystis is merely an incidental finding in the muscles. This happens to be from a duck with this highly compartmentalized, very large cyst. And the morphology of these muscle cysts will differ considerably from species to species. Other wildlife entering zoo grounds include raccoons. And of course, you all know that raccoons Caribelus ascaris procyanus, the larvae of which are notorious for causing visceral larval migrans in mammals, including humans, but they can also cause visceral larval migrans in birds. It's been quite a problem in some collections. LA Zoo, San Francisco Zoo have all had problems. This was from a sun conure, and you can see the tract going through. They seem to like to hug the white matter, gray matter interface. They cause marked vacuolation and necrosis, Gitter cell infiltration, sometimes almost a granulomatous response, and of course here you can see the larvae that can be identified as ascarid larvae because of the lateral alae. Even diseases that require intermediate hosts or other vector transmission from wild birds can affect collections. The Equatorial penguins are particularly susceptible to the development of malaria, as are some of the mountain passerines like the mountain tanagers, some of these birds. You bring them into a nice environment like San Diego Zoo and put them in an outside exhibit and they'll get malaria. In fact, we don't even keep penguins anymore at San Diego Zoo because of this. This is a mountain tanager with massive hepatomegaly. The liver's easily twice the size it ought to be. Has a rather dark rusty color that might make you think of hemochromatosis. The spleen is massively enlarged. This is it up here. Again, the passerine spleen is elongated or comma-shaped, and this spleen is easily 5 times the normal size. The livers are very congested, and marked extramedullary hematopoiesis is present. And the schizonts of malaria can be, the extra erythrocytic forms can easily be seen in the sinusoids, and if you're lucky you can find the intra-erythrocytic forms present in sections as well. It has to be distinguished from hemoproteus, which is a less severe infection, although we're starting to see what appear to be pretty severe hemoproteus infections in some of the small passerines that might be due to there being an abnormal host for another sort of a passerine. Leukocytozone is another hemoparasite. It's usually transmitted by Simulidae, black flies, those sorts of organisms. The one most people are most familiar with is Leukocytozone Samandii. There are many different species in the anseriforms and in the hawks. They tend to cause these very large structures, causing elongation of what appear to be leukocytes. In some of the passerines, the leukocytozone that we see has a much more rounded form. And in histologic section, it's difficult to figure out what the cells are. They look like some sort of a strange little rounded up macrophage, rather than these elongated cells that I was typically used to in ducks and hawks. And then these megaloschizonts can be found in the case of the duck Samandii. They're in the brain. This is in a Thailand bay owl. We don't know the species of leukocytozoan, but in this case it's in the kidney. Mosquitoes can also transmit viral diseases. The whooping crane, there's been an outbreak described of eastern equine encephalitis in whooping cranes. They developed severe necrotizing hepatitis from this virus, multifocal hepatic necrosis. As a consequence, now vaccination is undertaken in some of these rare cranes, rare and endangered crane species. Pox can also be transmitted by various arthropod vectors. And in many of the species in which we have problems with malaria, we also have problems with pox, little passerines that come in from other countries, mountain species. Also passerines in Hawaii that are raised in captivity and then scheduled for reintroduction when they go back out into the wild where they're exposed to mosquitoes and pox, or perhaps because they've been hand-reared, these birds go on to develop severe fulminant pox. Pox has different manifestations in different species of birds. In the citizens, it's almost always a wet form of pox affecting mucocutaneous junctions or mucous membranes. And here you can see a group of blue-fronted Amazons in quarantine with swollen eyes. They're all sort of winking at you. And you can see the severe conjunctivitis with slightly elevated lesions of pox involving the eye. It will also occasionally involve the trachea and bronchi, where it leads to secondary bacterial and fungal infections. A Occasionally it will extend down the GI tract, and the differential here, of course, would have to be trichomoniasis, but these are in fact large pox lesions affecting the esophagus and crop of a Pyonis parrot. And it'll infect the oral cavity around the choanal slit, and again predisposing to severe bacterial and fungal secondary infections. The healed lesions are important to recognize as these depigmented plaques and loss of the normal papillae in the oral cavity, because there is some question about whether birds that have pox can be lifelong shedders, and if they are, you don't want to introduce them into a collection. Dry pox is not very common in citizens, but it will occasionally occur. In contrast, in birds of prey, pox is exceedingly common. This was in a breeding facility. You can see these large dry pox lesions that occur on the feet and also around the commissures of the mouth and on the face, non-feathered portions of the body. So there's quite a variety of manifestations of pox. Histologically, it'll also vary from species to species in how large these Bollinger bodies are in the cytoplasm, but the typical ballooning degeneration with cytoplasmic inclusions is usually present. In this case, there's been secondary candidiasis infecting this pox lesion. Diseases also enter the collection through feeding practices or husbandry practices. Quite a popular exhibit in many zoos and parks today is where the public can go in and actually feed different birds. Usually rainbow lories are used. They're a fairly hardy citizen as nectar eaters go. The public can feed them little pieces of fruit or pineapple, or in some cases little cups of nectar. The problem here is that the disease can be transmitted. The public is encouraged to wash their hands after they leave the exhibit to prevent them from getting psittacosis or anything from the birds, but they're not necessarily encouraged to wash their hands before they feed the birds. So they can transmit E. coli and other things. Also, when nectar sits out on warm days in the Central Valley of California, even if it only sits out for a few hours, and if it's honey-based, we get sporulation of Clostridia. We've had Salmonella transmitted this way, a variety of things into these nectar-eating birds, not just in exhibits where people are present either. This is an example of a Clostridial infection in a lorikeet. You can see gas bubble formation in the crop, which exhibits crop stasis, sort of a murky content to the nectar-based diet. And here there's been necrosis of the ventriculus and proventriculus and dark discoloration from the melena created, and an enlarged liver with multifocal necrosis also. And I think this bird did have some gas bubble formation. Many zoological parks in different areas of the country have to deal with other birds coming in and other bacterial infections. This is Clostridium calinum, another Clostridial infection usually carried by bobwhite quail. Bacterial infections in birds can take many interesting forms. I already showed you that caseous granuloma of Salmonella. This is a case of osteomyelitis of the skull. The bird had a sinusitis and otitis due to a mixed bacterial and fungal infection. It was a Grandala, a thrush-like bird from China that came into quarantine, and secondary to that developed an osteomyelitis. Birds have an extensive cervicocephalic air sac system. It doesn't branch off of the lungs like the other air sacs do. It in fact branches off of the nasopharynx, includes the infraorbital sinus, and extends in varying degrees to involve pneumatization of the skull. So you can get some pretty interesting bacterial infections or lesions in the skull secondary to this, and this was a case of granulomatous osteomyelitis of the skull secondary to otitis in a small citizen. This is just to remind me to mention that zubirds are no different from other birds in that they form granulomatous inflammation in response to a wide range of organisms, not just to higher organisms like fungi and higher bacteria like mammals do. And so this was a E. coli granuloma in a citizen. It was actually infected in ovo, and this granuloma was present at birth. It's a very good discussion of the various kinds of inflammatory responses that differ between birds and mammals and reptiles in a review article by Dr. Montali a few years ago in Journal of Comparative Pathology. Fungal infections in zoo and aviary collections are a perennial problem. Aspergillus is probably one of the most significant and serious diseases that we see in zoo collections, and it always tends to affect sort of rarer birds. The pelicans are particularly susceptible to this. Another reason for not keeping penguins, I'm sorry, are particularly susceptible, and it's another reason for not keeping penguins in other than very controlled environments. This is a case of Aspergillus in a penguin involving the anterior thoracic and cervical air sacs. Did I say pelican again instead of penguin? No. Like we've mentioned with tuberculosis and with yersiniosis, there can be many different gross manifestations of aspergillosis. This is the granulomatous form with multifocal granulomas present throughout the lungs of this prairie falcon. Can also have a form in which you see a chronic fibrinous serositis, some of these granulomas, but also plaque-like lesions. These plaques form almost a plastic-like cast of the air sacs, as you can see in this passerine. And in some of the birds you actually see these fungal mats of the cotton wool and the black fruiting bodies of the organism. Aspergillus and many other fungal infections like blood vessels and can form these septic fungal thrombi. There are multiple consequences of this, including sometimes invasion and rupture of large vessels. This was a Canada goose that actually bled to death from rupture of basically the equivalent of a subclavian artery because of Aspergillus erosion. We also see infarctions in multiple organs and tissues due to dissemination in the vessels. This is a cerebral infarct due to Aspergillus. And this is a case of infarction of breast muscle due to Aspergillus. Aspergillus lesions can be solitary. Here's a solitary sort of fibrinous plug in a main stem bronchus as an incidental finding in a flamingo. We see a form of Aspergillus in which there's almost a saddle thrombus of Aspergillus that occurs at the syrinx, at the bifurcation of the bronchi, and can actually cause obstruction and asphyxiation of the bird in the absence of any other lesions of Aspergillus. And so sudden deaths in zubirds, that's always something that should be examined and checked, is the syrinx. Viral diseases, other than pox, are much less common in most zoo settings, mainly because quarantine procedures are often quite good. There are newer tests to diagnose some of these diseases, but this is a case of Circovirus or cytosine beak and feather disease. This used to be quite a problem in many collections and still is, but thanks to the fact that there's a PCR test from blood that can be done, you can pretty much exclude it from a zoo collection. Classic lesions include malformations of the feathers with hemorrhage and inflammation in the pulp, shown here in these large flight feathers. The normal pulp should be pale and glistening, a bit like this distal portion in this feather. There may also be lesions in the oral cavity, pharynx, with deformities of the bill. The classic lesion is this yellow-gold plaque due to necrosis of the epithelium. In addition to hemorrhage and inflammation of the pulp, the key features to look for are individual cell necrosis with intranuclear inclusion bodies that will be present both in feather epithelium and feather follicle epithelium. And these large cells with basophilic cytoplasmic inclusions, so-called botryoid or grape-like cells that consist of probably virus factories but also phagocytized debris in macrophages. We used to make the diagnosis on electron microscopy, where you found these millions of these small particles, about 27 nanometers in diameter, arranged in these wonderful ribbons and festoons, and these are the circoviruses. But now there are PCR techniques. Other diseases that are traditionally seen in pet cytosines are not that common in zoo collections, but this was a case of Pacheco's disease or cytosine herpes virus. The form that we tend to see in zoo collections now is a more chronic form of birds that have been carriers for a long time, have been housed in collections for a long time, and for some reason develop an acute or subacute chronic hepatitis with hemorrhage and necrosis, and often with evidence that this has been an indolent ongoing disease, in contrast to the acute necrotizing disease that we used to see in the 70s in cytosines and quarantine stations. Inclusion bodies may be smudgy or large. You may see Cowdery type A, and syncytial cells are usually common. Some other herpes infections that we've seen in zoological collections include proliferative bronchitis. And you can see this wedge-shaped lesion of pneumonia. Most bronchopneumonias in birds are manifest on this lateral surface of the lung. That's why it's so important to remove the pluck during necropsy. So you can examine this outside bit. And in this disease, there's marked proliferation of epithelium in these huge syncytial cells with intranuclear inclusion bodies. There was some question whether this was just a form of Pacheco's disease, but some recent molecular work that was done for me by Dr. Rick Garber up in Seattle has shown that this is a distinct alpha herpes virus, differing from classic Pacheco's. We also occasionally see herpes hepatitis in other species. This was from a weaver finch in which there was hepatitis and inclusion bodies were seen that are presumed to be herpes but not yet proven. And Dr. Tracy McNamara has seen an outbreak of what appears to be a novel alpha herpes virus in pheasants at Bronx Zoo, and recently we've had a few sporadic cases of herpes hepatitis in phasanids down in San Diego as well. So herpes virus hepatitis are out there and are well described in a multitude of species in the literature. Adenoviral infections, the usual setting in which we see them is recrudescence of adenovirus, and this is in this intestine in a psittacine bird. But we also see disseminated adenovirus infections. Here's recrudescent infection in the kidney of a lovebird with these very large cells that would have to be differentiated between that and polyomavirus. But particularly in Agapornis, the lovebird species, and some other species, there have been reports of disseminated hepatic necrosis and pancreatic necrosis due to adenoviruses with these very large basophilic intranuclear inclusion bodies. Fairly recently, there's an outbreak that's being written up in birds of prey at a large breeding facility in which adenovirus went through one whole age class of hand-reared youngsters, causing severe massive inclusion body hepatitis. Again, inclusion body hepatitis due to adenovirus is well recognized in domestic species. It occurs as marble spleen disease in chickens and inclusion body hepatitis marble spleen disease in pheasants and inclusion body hepatitis in chickens. We've also recently had a couple cases of adenoviral hepatitis in hornbills at least 3 different collections. It appears to be a sporadic disease. Almost all the birds had been stressed by something else, so it's probably a recrudescent infection. Because most zoos are involved in breeding and may share birds on breeding or hand-rear birds from other collections, we still do see polyomavirus infection occasionally. This is a young macaw with psittacine polyomavirus. You can see that it's very anemic and there are multiple petechia. There's some edema. Anemia is particularly evident in the snow-white color of the pancreas, which should be light pink, but since he was so anemic, it was white. You can see the liver swollen and mottled, and there are petechia on visceral surfaces, very pale myocardium because of the anemia. Marked splenomegaly, and again hemorrhages throughout the viscera as well as the skin. Polyomaviruses give these very large, almost non-inclusions with marginated chromatin and very pale swollen centers. And in the large psittacines, it tends to be more in endothelial cells, but will also affect epithelial cells. In the larger psittacines, you don't tend to see the feather follicle involvement that's classic budgie fledgling disease, the species in which polyoma infection, psittacine polyoma infection was first recognized. There are molecular probes now for this virus that can help prevent it from being in a collection. We see a lot of viral diseases that we don't know what they are. This is a king vulture. Victoria the vulture died with a vesicular disease that involved multiple surfaces from the oral cavity down through the esophagus and crop. And electron microscopy wasn't very rewarding. We saw some virus particles that could have been a Colisi-like virus. Metazoan parasitic diseases also tend to plague zoological collections, partly because of the natural substrate and the availability of intermediate hosts. One particularly perplexing problem can be capillariasis, here shown in the crop. And histologically, the organisms are insinuated in the stratified squamous epithelium, and other species of capillaria also affect the intestinal tract. where they again insinuate themselves within the crypts and around the villi. This can be a hard infection to get rid of. Some of them have direct life cycle and some are transmitted by intermediate hosts. And some of the newer anthelminthics have been implicated in causing aplastic anemias when used to treat this particular infection. Some other examples of metazoan parasite infections that we still see in zoological collections include things like Tetrameris, here in an exotic colubiform, and histologically these large females that are gravid and are red because they are bloodsuckers. Heterachus in the GI tract of a wild turkey. If one species is in a collection, they can spread the organism to another species that is more susceptible. A classic example is Heterachus isolantii, which is not very pathogenic in some species of gallinaceous or chicken-like birds, but when it gets into some of the exotic phasanids can cause a severe granulomatous quasi-neoplastic lesion in the ceca. Some other non-infectious problems that we see in zoo collections are, of course, trauma, mixed species exhibits, and normal intraspecific and conspecific behaviors can lead to trauma. One thing in Zubirds is if you have an animal that's trauma, don't assume it's trauma, do the histology, because we often find underlying causes of debility or abnormal behavior which led to the animal being traumatized. In waterfowl particularly, amyloidosis is a problem. This is severe amyloidosis in a goose. A very strange, gross appearance of amyloidosis with biliary stasis and eventual hepatic rupture and hemorrhage in a passerine bird, and typical appearance of amyloid like you'd expect to see in a mammal. Many of the times we can find underlying inflammatory conditions suggesting that this is a typical inflammatory secondary amyloidosis. You can see this bird was also has hemosiderosis, suggesting a response to the chronic inflammation and debilitation. Sometimes we can't find anything but the amyloidosis. This is also seen in wild waterfowl. Nutritional diseases are fortunately fairly rare within zoo collections, although we do still see occasionally things like white muscle disease from vitamin E selenium deficiency. Atherosclerosis is a problem particularly in the birds of prey and the psittacines, here in the aorta. Acute visceral gout happens in response to dehydration or to primary renal disease. Acute renal necrosis is often idiopathic, although sometimes it occurs from diets abnormally high in protein or from hypervitaminosis D. This is from a dwarf cassowary with very severe nephrosis for which we never found an etiology, and it suffered from very diffuse gout. Histologically, acute tubular necrosis and classic gouty tophi with the starburst appearance. Some of these birds, particularly if the renal disease has been precipitated by vitamin D, may develop secondary mineralization, sort of like uremia in dogs and cats, here in the heart of a psittacine. And in renal failure, it's common to see mineralization in the proventricular glands, demonstrated here with a mineral stain, and also in the coilin, or horny lining of the ventriculus. Of course, articular gout is considered to be a more chronic metabolic disease, and here we can see gouty tophi insinuated between tendinous structures in the bird. And to prove gout, you need to do an alcohol fix and stain for the gouty crystals. Some species seem quite prone to develop gout, in our collections at least, particularly the crowned pigeon. Since reproduction is an important part of zoological function, we do see a lot of reproductive lesions. This is salpingitis in a peregrine from a breeding collection, and oophoritis with rupture and hemorrhage in a partridge from a zoo collection. Birds are at risk of developing dystocia 2 times in their life, one when the egg tries to get out of the mother, and one when the chick tries to get out of the egg. It's very important that egg postmortems be performed in birds in zoological collections. One of the main causes for failure to pip is degeneration of the hatching muscle, in which vitamin E selenium deficiency and the dam has been implicated. Malpositionings are also important causes of failure to pip. This little condor chick has an edematous head because he'd wrapped his head over his wing, over his left wing, when it should be under the right wing for hatching. They can only pip in one direction. Other causes of in ovo death include strangulation by egg membranes, as in this milky stork chick. Once they're hatched, omphalitis is a problem in some baby birds, particularly the ground dwellers like that sand partridge. Failure to resorb yolk is a common lesion. This can be due to omphalitis, It can also be due to abnormal feeding in these youngsters or abnormal gut motility. Normal yolk sac consists of an outer membrane with very fine villus structures lined by these absorptive cells, which are generally vacuolated. The central cores can have extramedullary hematopoiesis, so you have to be careful not to overinterpret that as inflammation. When the yolk sac is inflamed, these very delicate villi are disrupted. You'll find marked inflammation, hemorrhage, and often cholesterol clefts from breakdown of yolk products. Animals that survive omphalitis will go on to develop a variety of bacterial problems. This was a staphylococcal omphalitis, and you can see there's a staphylococcal myocarditis and hepatitis in this particular chick. It's also important that to look for congenital deformities in these breeding populations. This was a case of tarsometatarsal aplasia in an Amazon parrot. And here we have a dysplasia of feather follicles from some breeding peregrines, even though these was an outcrossed pair, not at all related, captured from very different geographic areas. Crossing of these parents consistently produced these feather abnormalities, and of course you'd want to remove this from the population. Another congenital defect, renal agenesis in a little passerine. The other end of the spectrum in the zoo collections are the very aged birds, and we frequently have animals living past what would be their normal lifespan in the wild. And so we do see a variety of tumors and other aging changes. This was a hemangiosarcoma in a pigeon and round cell sarcoma in an elderly go-away bird. We really haven't defined what type of cell this is. It might be histiocytic. This was a case of Dr. Ilse Stollis's at San Diego Zoo. So that ends my talk. You might recognize a few well-known zoo pathologists in this picture. Dr. Richard Mentale, Dr. Bruce Rideout from San Diego Zoo. And in conclusion, I'd like to say that the cases that I presented today are a reflection of the specific collections that I've dealt with, namely Zoological Society of San Diego's San Diego Zoo and Wild Animal Park, and some of the zoos in Northern California who submit cases to the Veterinary Medical Teaching Hospital PATH service. What is seen in any one collection will differ according to what diseases are present in the geographic area and what species are present in the collection. There's a lot we don't know about the pathology of zoo birds. A lot remains to be done, and hopefully this tape will help people with some common diagnoses and pave the way for future recognition of unknown diseases. Thank you very much.